Michelle Byer, your host of Addiction Voices of Hope, heard here on WNPQ 95.9 The Light. Addiction Voices of Hope is presented by this month's sponsor, the Phoenix Recovery Support Services, and these other fine sponsors, Quest Recovery and Prevention Services, Malone University, The Cash Cowgirl, and What's Up Ohio, an online magazine, Solace of Stark County. Please welcome my guest today. It's Keith Hochadel. He is the president, CEO of Quest Recovery and Prevention Services. Good afternoon, Keith, and thank you for being here with us today.
Afternoon, Michelle. Thanks for asking me to come.
Now, Keith, you must have a really tough job, because Quest is pretty large, is it not?
Well, Quest is a significant provider of drug and alcohol services, prevention, education, treatment, recovery services. We've about 170 employees, primarily Stark County programming. We also have a correctional program in Conneaut, Ohio at Lake Erie Correctional.
Oh.
And recently have opened office in Carrollton and Minerva in Stark County, and obviously Carrollton is in Carroll County. So we continue to grow.
Oh, yes. Well, you know what? Unfortunately, that's where we have to be today. We're growing, and usually that's a good thing when it comes to a business, but I'm not thinking that's a great thing with this type of business, only because we don't want people to have to need this, do we?
No, I think if we could do education and prevention most of the time, I think we would be much happier to do that rather than the treatment services. The good news is, as the number of folks continue to increase coming into treatment services, our outcomes are improving above and beyond the number of people that are coming in. And with the opiate epidemic that we're seeing in our community, there are more people seeking services, and a lot more people seeking services that are self-referrals as opposed to the courts and jobs and family services and that now than there ever has been before.
Well, I'm glad that people are actually seeking services. And today I really want to get into the word addiction, because a lot of people are confused. They think, oh, you're not, you could stop doing that drug anytime you want. And I've had arguments about eating disorders that they can't be helped, but a drug addiction can. Addiction is addiction. What is addiction? Is it a disease? That's what they're saying it is. Is it a disease?
Well, yes, we believe that addiction is a disease. It's a primary, chronic, progressive, and if not stop the use, fatal disease in the end. What makes it a disease is it has a set of symptoms that sets it apart from everything else, and there's some clinical manifestations that go along with that. So it's not a moral disorder where people are just behaving badly.
Okay.
It really truly has the signs and symptoms of a disease.
That's just, is this inherited, or is this a gene?
So it's kind of interesting, because when we look at risk factors for somebody going down the continuum from use to abuse to dependency to addiction, we look at 5 factors, and one of those is the genetic or the hereditary part. The common figure people throw around is about 55% of the time it's passed down from generation to generation. There's some statistics in Europe say that it could be as high as 70-75%.
Wow.
But for the most part, we look at about 55% as a general number. But there's also 4 other risk factors that go along with that. One being the constitutional part that says that 2 people can use the same substances, one of them becoming addicted, the other one not. Mm-hmm. Similar to people that are allergic to strawberries. Some of them have a small itch or rash, and other ones end up in the hospital.
Right.
There's the environmental part that says that the environment that people grow up in either promotes or allows there to be substance use or disallows that. You think of somebody who's in college, if they're living in a fraternity, that environment is more likely prone to alcohol use, in some cases, not all. There's the enabling fact of somebody allowing there to not be normal natural consequences that allows it to continue, and finally there's the use part. So the more risk factors somebody has, the more likely they are to develop that. But there is definitely a genetic or inherited piece to that.
Now, there are so many different things to become addicted to. Uh, with this show, we will be covering all addictions, eating
Sure.
disorders, gambling, there's sex addiction, and people give leniency to people with eating disorders opposed to people with heroin or alcohol. Uh, why do they feel so much sorrier for someone? I've suffered from eating, shopping, all of them, and I can't help any of them. So why is it that people look at heroin people and say, well, you could stop and just, I don't feel sorry for you. Why is that?
I think it's because they truly believe that people can stop, that without a good understanding that there are changes that occur in the brain, most likely at first initiation of any use, and then as those brain changes occur, they impact how people react to stimulus, how they react to not having that substance in their body. Um, but again, it goes back to people believe that if you're drinking or if you're using heroin or you're using cocaine, you ought to be able to see what's going on in your life and just stop. Um, when people tell me they're trying to control their use, we don't typically try and control anything that we don't already know we have a problem. So you don't hear a lot of people say, you know what, I really have to control how many green beans I eat.
Right.
But they will watch, things that impact their life, like their eating, their shopping behaviors, gambling, and their substance use. So, I think there's just that stigma, and it impacts recovery as well, which is why I'm glad you're having this venue where people can talk about that.
We need to get this out. We need for a lot, even family members they don't understand why their daughter, their son, their sister, their brother has this addiction problem because they may not have it.
Right.
And, the person, my child did not come up to me one day and say, Mommy, when I grow up, I want to stick a needle in my arm.
Mm-hmm.
That just isn't something we say to our parents. And when we're in this addiction, we are not who we normally are. Is that correct?
That is very correct. And when parents give birth to a child, they don't say, "Boy, I really hope my son or daughter's an alcoholic or a drug addict or something." That's not the normal course we want for our kids, or for our significant others in our life. I think that as time goes on, the more transparent people can be about recovery. We're hoping by raising that awareness, that lifestyle, that recovery lifestyle, will be more likely.
Well, that's what we are definitely hoping to get more people into recovery. We're actually hoping to prevent it so we don't need to do this. But there's so many stigmas associated with addiction, and I really would like to pinpoint some of them. We already talked about the fact that these parents and the people think you can just stop and they don't understand it. And when we come back, because we do have to take a break, I want to get into a couple more of those stigmas that are going on, because there are mental health issues as well.
Sure,
that
absolutely.
play a huge factor in this. So we are going to take a short break. If you have a question for Keith, please call us at 330-492-6881. Welcome back to Addiction, Voices of Hope. I am your host, Michelle Beyer, here on WNPQ 95.9 The Light. My guest today is Keith, the President CEO of Quest Recovery and Prevention Services. And before we went to break, Keith, we were talking about stigmas. And one of the things that I didn't even know until I went through my whole 37 years of life at that point. I'm much older now, we won't say how much older. I did not know I was bipolar. How common is that mental health and addiction can run, and often do run, hand in hand?
Well, in the treatment centers, and the population that we see, it's better than 50%. Um, the question becomes is what was there first, the substance use as the primary, and then the co-occurring disorder, the mental health disorder, as the secondary, or was the mental health disorder there first, and then the compensation mechanism was the substance use. So that's one of the challenges that we have as we're providing treatment services, is trying to sort out which one came first, because oftentimes people have undiagnosed mental health disorders that we don't see until maybe they've stopped using substances for 30 days or 60 days, and then all of a sudden they're acting a little differently, exhibiting maybe signs of depression, signs of bipolar disorder, and then we have to have a psychiatric evaluation to see, okay, what do we have here? Is this part of normal recovery? Because there are things called post-acute withdrawal symptoms that mimic some of the mental health disorders. So we have to be really good at kind of timing that and knowing when to look for that stuff.
What is the acute?
So when somebody has stopped using substances, so we use alcohol as an example. So they've drank for a lot of years, they stop using, so that initial 0 days of stopping the alcohol use up to about 7 to 10 days, that's called the acute detox part. That's what people get hospitalized for. Then we have what's called a protracted withdrawal period of time that goes from about 10 days out to around 30, where people feel pretty good. They have some ups and downs, but they think, you know what, I got this licked. I don't need any help. I'm really cool with this. And then as the brain kind of tries to repair itself from all the damage that was done, we get into this thing called post-acute withdrawal. And post-acute withdrawal has some really specific symptoms to recovery. One of them being the mind races or inability to think clearly. I liken it, if you go to the carnival and the little ducks that go around in a circle, and they're going around like 100 miles an hour, and you're trying to pull one of them out. So that happens to people, and they have a really hard time connecting the dots in their thoughts. There's emotional either reaction, overreaction, or numbness. So they snap a shoelace and throw the shoe through the window, or somebody passes away and a significant event, and they're just numb throughout that. There's sleep disturbances, not necessarily bad dreams or weird or using dreams, but it could be can't get to sleep, wake up in the middle of the night. There's stress sensitivity, where the ability to manage stress isn't as good, or to recognize stressful situations, and then some people have some coordination issues as well. So we see that starting at about 30 days abstinent, and it can go out to about 2 years, but usually the peak's about 30 days to 120 days, which is right about the time in a 30-day treatment program or a 60-day treatment program where we're letting them go, or they may be being released. That's why we believe that a minimum 90 days is a good number of days of treatment.
I agree. I definitely agree, and I have been talking to a lot of people about that. They're like, oh, I was in there for 2 weeks. Well, no, that's not enough. How long does it take to get a substance out of your body? I mean, if you're only in treatment for 2 weeks, in my opinion, I don't believe that's going to help you too much.
Well, I think that that brings up one of the issues that we have. We're treating a chronic disease, one that we believe is a lifetime thing, that if somebody picks up, they go back to, you can't go back to being a cucumber once you're a pickle. But we have traditionally treated it from an acute treatment model. So a lifetime disease we treat in 30-day, 60-day, 90-day chunks of time. So, that's one of the stigmas we have to get by, is that after 30 days you should be all better, after 90 days you should be all better.
Right.
And oftentimes I've had parents bring their kids to treatment and say, I would like my son to be back the way he was back before he started using. Well, you really don't, because that's the same person that ended up using. So we would like new and improved, not just take them through the car wash so they look better. We want the inside the car scrubbing and getting the carpets clean too.
I love your analogies. They're just so awesome. Now, can your brain be repaired? I mean, if you're doing all this drinking or substance abuse, can your brain actually repair itself? And if it does repair itself, how long? I mean,
that's really hard to say, and I think it differs for every individual that uses substances. I have met some people that have considerable impairment and brain damage from years and years of drinking. I know some other people who had a limited exposure, and you probably wouldn't know.
Okay.
There are some brain changes, and oftentimes, you know, if you've seen some of the studies with cocaine or crack cocaine, and people who have been absent for a while, and they show them flashes of triggers, the people, places, things, and they can show that the brain's still lighting up in those areas. So I think we recognize that in some people that damage is long term, but the initiation piece there probably maybe lies dormant, for lack of better terms. So there's some really good studies by the National Institute of Drug Abuse on brain changes.
Okay. Now I know triggers. Explain, what is a trigger? I mean, not everybody knows what a trigger can be. I mean, I say it all the time.
Okay.
What is a trigger?
So triggers are typically people, places, things that remind somebody of use.
Okay.
And we spent a whole lot of time previously on relapse prevention programs trying to tell people don't go around the same people, don't go to the same places, don't look at the same things. But we missed this whole segment of what I like to call setups. And those are feelings, actions, thoughts, and attitudes that oftentimes people keep to themselves, but other people can see them in recovering people. And they might be, you know, depression, or that thought that says, hey, I don't need to go to these 12-step meetings anymore. I know what I'm doing. I got this thing taken care of. So those are the kind of the underlying pieces and parts that once somebody has too many of them, or they start to look like when they were using, and they come into contact with one of those triggers, then they're more likely to continue through that relapse cycle into, you know, the obsessive thoughts and then the drug seeking, and then ultimately the use. But we have to be able to identify what those setups are.
Okay. I know for myself, I had to change a medication because it would numb. You put it under your tongue and it would numb under your tongue. And for me, that brought me back to cocaine use.
Sure.
And immediately I said, oh, we cannot have this. But Keith, we have to take a break.
Okay.
And when we come back, we're going to touch a little bit more on addiction and, you know, what happens with relapses and how often and things like that. If you have a question for Keith, please give us a call at 330-492-6881. We'll be back in a moment with Keith. This is Addiction, Voices of Hope on WNPQ 95.9 The Light. Welcome back. This is Addiction, Voices of Hope. I am your host, Michelle Byer, here on WNPQ 95.9 The Light, and we are talking to Keith from Quest Recovery and Prevention Services. And when we left, we were talking about, we talked about stigmas, we talked about triggers. Now, I'd like to talk about relapse, because you hear the word relapse so often, unfortunately. Is the relapse something it's much more common than people in recovery? I mean, I don't know how many people versus, you know.
So one of the hallmarks of this disease is it's a chronic relapsing disease.
Okay.
People return to using, maybe because, you know, they have some sobriety or they have some abstinence from a substance. They think, you know what, I really wasn't that bad, so I think let's go back and try and be a social user.
Oh, okay.
Often that doesn't work out very well.
Right.
And then I think we use the term relapse to indicate a return to use, when realistically relapse is a process. And it's a process of returning to or never leaving those same feelings, actions, and thoughts as when a person was using. And if we don't stop that process, then the end result of that is a return to use. So relapse isn't a single event. It's a process that occurs over a period of time. And good relapse prevention programming identifies what we were talking about before the break. What are those setups? Am I starting to hang out with the same people, places, and things? Am I recognizing some of the physical symptoms and some of the unconscious or the thoughts that I'm having? So I think we try and teach people and the folks around them to look for certain things that would be potential setups or triggers to try and build some coping skills around that.
And education is so important for this. I know when I'm thinking the wrong way, that stinking thinking.
Mm-hmm.
You know, oh, I could take a couple of these pills because I'm in pain, and then, well, wait a minute, well, I could do, you know, so there's some stinking thinking, as we like to call it. How, give me a time frame if you can. How long, if you're in recovery, let's say 90 days, that you can just go, can you go back anytime? I mean, can you be in recovery for 20 years and go back and relapse?
So that happens often,
Okay.
probably too often. So I'm in recovery for 17 years or so. If I go back and start drinking again, I'm most likely not going all the way back to where I was when I started drinking at 15 and a half. I'm going to go back quickly to where I stopped when I was 35.
Okay.
So, and this is a hard concept for people to understand, that the disease actually progresses while you're not using the substance. And going back doesn't mean you go all the way back to the beginning. It means you go back to, you know, where you left off rather quickly.
And when you educate, I believe that makes you more self-aware if you get educated. And I know that I was educated, and I'm a little more self-aware of my patterns, such as a feeling, or I noticed I said something, and that's, you know, is that something that you teach, to be more self-aware so you can see these patterns coming on?
Well, and you have to. You know, people have a relationship with the substance.
Right.
And what we're trying to get them to understand is the relationship has to change from a relationship with that substance and that lifestyle to a relationship with recovery, and whatever that means for them, because everybody's recovery is going to be a little bit different. You know, we become invested in things that we love or that we're heartfelt for, and if we can move people through and help them self-motivate themselves to a point where they realize that, you know what, I really enjoy this lifestyle and it is so extremely valuable to me, then I'm going to keep doing that.
Mm-hmm.
And that's the part that I think we need to continue to impress upon people, and the part that as a recovering community, we need to be accepting of that recovering individual.
Now, there is something really important that I need to have explained. The sleeping lion is referred to our disease. I did not drink when I was younger. I did not like the taste of it. I did not take aspirins. And all of a sudden, at the age of 37, it was high speed. I was drinking anything in sight, doing cocaine, everything. Is that what a sleeping lion is? It's just lying there?
Yeah, we don't know. We don't know what's there until somebody picks up and uses again, or uses any substance at all. So we don't know if somebody's allergic to poison ivy until they get in poison ivy.
Okay.
And this is the same way. We don't know somebody's going to have an issue until they have an issue, until they use.
Are there some personality traits? The poor me's, it's your fault, you know, can that be?
They can contribute, yeah.
They can, okay.
Yeah, absolutely.
Okay. Well, that is all the time we have for today. But to recap, can I talk straight today? Recap briefly, addiction is a brain disorder, and it is not something we have control over. For more information on addiction and Quest recovery and prevention services, please visit my website at www.addictionvoicesofhope.com. Tomorrow's show, I have a guest who's going to tell us his tale of being a pharmacist to a felon to president, CEO of a big company. If you would like to be a guest on Addiction Voices of Hope, go to www.addictionvoicesofhope.com and click on radio program and fill out the guest form. You've been listening to Addiction Voices of Hope. I am your host, Michelle Byer, heard on WNPQ 95.9 The Light. A special thank you to this month's sponsor, Phoenix Recovery Support Services. If you would like to be a sponsor, please visit the website www.addictionvoicesofhope.com. Remember to smile at someone today. You may just save their life. And please love yourself first. Thank you very much. Have a great, blessed day.